Hello friends, myself Dr. Syed Nazim Hussain. I'm a consultant dermatologist at Royal Skin Clinic and I practice at Max Hospital, Gurgaon. Today we are going to talk about Minoxidil and its role in hair fall. So Minoxidil is a medication basically which was meant for antihypertensive, and accidentally it was discovered that it gives more hair growth around the face. So that's how the uses of Minoxidil started, and the topical solutions of Minoxidil started developing by these pharma companies. Its uses are now widespread in any kind of hair fall conditions. So basically it is an FDA approved indication for androgenetic alopecia and female pattern hair loss. But there are other indications also where it is being used widely, like alopecia areata, different enhancement of eyebrows, and different various other issues where a person is looking for increased hair growth. And this is about the Minoxidil. Now let's talk about this medication. How does it work? Okay, how does it increase the hair growth on our scalp? So basically Minoxidil comes in different formulations. Like it comes in a concentration to 2 to 5%, although there are 7%, 10% available in the market, and it is in the formulations of solution, and now you will be having some formulations as a foam formulations also. So basically there are different pathways it works. Like first and foremost, it gives vasodilatation in the scalp, and it also signals different pathways which eventually leads to the increased hair growth, and it is also having an anti-inflammatory effect. But if you talk about the hair cycle, the hair it has 3 phases. One is the growth phase, which is called anagen phase. One is the stagnant phase where the growth stops, which is called catagen, and last is where the shedding happens, like hair starts to shed off from the scalp, which is called telogen. So this Minoxidil works on increasing the anagen phase of the hair. So it promotes the growth, it increases the anagen phase of the hair, and that's how the roots of the hair become more stronger. There is more melanization of the hair. It works perfectly fine on the where the hair fall is on the vertex or frontotemporal areas. It gives beautiful results. Now if we talk about the duration for how long it's to be used, how to start and how to stop it, it's always advisable to consult a dermatologist. You can't stop it of your own, it has to be tapered properly. Like many of our patients, they go Google search and they start using Minoxidil. They don't know like which formulation suits them. Many a times it can give dryness to the scalp if you don't use a proper concentration of, or if you don't know what kind of scalp you have. Some people have oily scalp, some people have dry scalp, or the condition is associated with, some people have dandruff or seborrheic dermatitis along with hair fall. So it's always better to consult a dermatologist before you start the Minoxidil. However, in females, like when we have female pattern hair loss, it's good to start with 2% solution or a foam formulation of Minoxidil. But in male, like androgenetic alopecia, it can be started with 5%. For how long it can be? We can start it like for 6 months at least. So it is to be started with 1 to 2 ml, either in the morning application. So where we have to part your hair, or it comes with a spray, and depending on the like what kind of density a person is having, either you can part the hair. It's not to be sprayed on the hair, it has to be very much into the scalp, so you can part the hair. And it has a dropper. All the solutions have a dropper or they have a spray. So if you spray 8 times, it is 1 ml of Minoxidil, or you can use a dropper. It is a dropper where you can use 1 to 2 ml. Put the drops and then massage it little bit with your fingers onto the scalp, not on the hair. That's how it is applied. And duration, as I said, it needs to be continued, and it's a discretion of a dermatologist who can suggest you for how long. But nevertheless, it takes around actually you want to get the results of Minoxidil, it takes around 3 months to halt that progression of telogen. Okay, when I said that anagen, 90% of our hair are in growth phase and around 2 to 5% are falling. So this is the normal cycle for all of us. Like around 50 grafts a day can shed, which is normal, but there should be equally the growth of the hair, which is also very, very important. So it promotes that growing stage of the hair though. So you get the visible results after 2 to 3 months of application of Minoxidil 5% and 1 to 2 ml on the scalp. And that's how it's to be used. As I said, it can't be stopped indiscriminately. It has to be tapered slowly, and then if somebody is using 5% 1 ml on the scalp daily before sleep, then it has to be alternate day for a month time, then it has to be weekly. So that's how it has to be tapered off rather than stopping immediately, which can give a rebound hair fall. Now let me talk about what are the side effects of using minoxidil. However, there are no that important kind of side effects where we need to get worried of. But then there can be simple irritation, there can be itching of the scalp, and there can be like flaking of the scalp, which is like very common, can happen. And that is because of the type of the minoxidil you have been using. Some minoxidils come up with alcohol preparations that can give more of an itching, irritation to the scalp. So as I said, it's good to consult your dermatologist and check out which kind of a minoxidil suits you better. Fine. Now as I said, like people have been asking like how long it takes, and many times the people say like there's an increased shedding of hair while they start using the minoxidil. That's true because as I said, there are 3 stages of hair growth. One is anagen, one is catagen, one is telogen. So when we start using the minoxidil, it increases the anagen, the growing stage of the hair, but the hair starts also shedding. So basically the shedding is the loss of the stem of the hair, but the root is still there. So you might notice some more hair fall in first couple of weeks, but eventually you will get a beautiful results after continuing the use of minoxidil for 3 to 6 months. That's all about minoxidil. But guys, if you have any questions, queries related, I hope you please consult us. You can call us, you can simply write a note, you can email us, all the things will be available, or you can comment. We will be happy to reply back. And I hope you like this video. Thank you.